I want to thank everybody for being here, and I particularly want to thank Dr. Podolsky as well as the UT Southwestern Medical School for both hosting this event, but for everything they're doing to help the people in this region as well as the people across the entire state of Texas respond to all different kinds of medical challenges we're dealing with, in particular what we're focused on today, and that is both COVID-19 as well as the flu season that is coming up. Before I get into the flu season, which is one of the topics that we talked about a lot before, I do want to make a couple of points with regard to COVID-19. People in the Dallas-Fort Worth area, one thing that you have observed, if you've been following the numbers, is that the COVID-19 numbers are improving in the sense that so many of the COVID-19 metrics are going in a downward trend. There's a downward trend in the number of people testing positive. There's a downward trend in the number of hospitalizations. There's a downward trend in the active number of cases. And I could go on with some other metrics. The point is this, however, and that is the numbers of COVID-19 are going down from an elevated level. We are not at all anywhere close to being in a safe situation in COVID-19. People need to understand that just because COVID-19 numbers are improving in this region does not mean that COVID-19 has suddenly left the Dallas-Fort Worth area or the state of Texas or the United States of America. It still exists, and it can still transmit at the same rate that it has been able to in the past. What people in the Dallas-Fort Worth area need to know is that the reason why COVID-19 is spreading less today than it was in the middle part of July or the latter part of June is because people in this region have been far more responsible in the way they conduct their daily lives. People have almost uniformly adopted the practice of wearing a mask. It's been reported by doctors in Dallas, doctors in Houston, doctors in Austin, doctors across the entire state of Texas that by everybody wearing a mask, that does lead to a reduction in the spread of COVID-19. In addition to that, people have been more responsible with regard to maintaining safe distancing practices, hand sanitizing, all the right strategies that people learned in March and April. They began to once again be very disciplined about in the latter part of July, and that has led to the downtrend in results. That downtrend has been so incredibly important, especially for places like UT Southwestern as well as this entire hospital district, because there was a time when hospital capacity was getting compromised. That hospital capacity is better now than before, but it will only remain better and must get even better by people continuing the practices of slowing the spread of COVID-19. Everyone must understand this very simple principle. Until we have medications that are capable of treating COVID-19, the only tool that we have to slow its spread is by everybody adopting these practices of wearing masks and maintaining best practices. Along the lines of best practices, I do want to emphasize one very important point. We constantly look for different types of settings and locations that can lead to the spread of COVID-19. Whether it be in Dallas area or the Houston area or the Rio Grande Valley area, one type of gathering keeps surfacing as a spreading event for COVID-19, and that is family gatherings or friends gathering together. There may be this sense that if you're gathering with family, you really are not going to be transmitting COVID-19, and that has been disproven right here in Dallas County. It's been disproven across the entire state of Texas. Or you may think that if you're just with some friends that you typically hang out with, it will not lead to the spread of COVID-19. And again, that has been disproven in Dallas County, as well as other regions across the state of Texas. The fact of the matter is, again, until we do have treatments that are able to treat COVID-19, anybody, anywhere has the ability to both spread and to contract COVID-19 and can lead to an overrunning of hospitals as well as lead to the deaths that have been on a dramatic increase in the state of Texas. Now that said, I want you to know that every single day we go to work to better elevate the response by the state of Texas in responding to both COVID-19 as well as other healthcare challenges that may exist. One of those healthcare challenges that is on the horizon is the coming flu season. And one of the primary goals that we wanted to achieve today was to have the ability to talk to the flu experts at UT Southwestern to learn what some of the best strategies are to make sure that we will be able to address the flu season, understanding this very important point. And that is, with a flu season that could be prolific, if that leads to greater hospitalizations, coupled with the hospitalizations that we're seeing for COVID-19, you can easily see how hospitals in this region as well as across Texas will be completely overrun with an inability for the hospitals to take care of the medical needs of everybody in the entire region. As a result, one of the recommendations that was made moments ago during our roundtable discussion was the importance of getting a flu vaccine early. And the time period for getting a flu vaccine begins as early as in September. And so one of the things we wanted to urge everybody today is to first understand the importance of getting ahead of the curve with regard to the flu during this time of COVID-19. And the best way that you can get ahead of the curve is by going up and making sure that you do get a flu vaccine. Another thing that we talked about was both the importance of testing for COVID-19 as well as the ability to increase the amount of testing that is taking place. Texas is very grateful for the prolific role that UT Southwestern plays in the testing regimen for COVID-19, already testing about 3,000 tests per day. They are working on strategies that will dramatically increase that up to initially perhaps as many as 15,000 tests per day. And then eventually, once all their different tools and strategies come into place over the coming weeks and months, maybe being able to test up to more than 40,000 tests per day. This is remarkable, and it's a byproduct of the excellence that we constantly see from UT Southwestern and what they work to achieve. Another thing that we talked about was PPE supplies. PPE supplies are something that are absolutely crucial in responding to COVID-19, but as you might imagine, COVID-19 coupled with the flu, coupled with the opening of schools this year, those PPE supplies are at an absolute premium. That said, someone who will be speaking here shortly has been the leader in the state of Texas for organizing and distributing those PPE supplies, and that is Chief Nim Kidd, the chief of the Texas Division of Emergency Management. I want to just tell you as an example of what they've been able to achieve, and that is they have already distributed more than 130 million masks, more than 33 million gloves, more than 8 million gowns and coveralls, and more than 4 million face shields. For schools across Texas already, even before schools have begun, they have distributed about 60 million masks and will continue to provide more over the course of the school year, and they've already delivered more than 560,000 gallons of hand sanitizer. So they are stepping up, making sure that the PPE needs of schools, of hospitals, of communities across the entire state of Texas have been and will continue to be met. What I can tell you is this. One thing that we are seeing in the state of Texas is a very robust, very comprehensive response by everybody at the local, state, and federal level, as well as especially with our healthcare community. And I'm very proud to see the role that UT Southwestern is playing in the response to COVID, in response to the flu, as well as all the other things that UT Southwestern delivers every single day. So Dr. Podolsky, thank you for hosting us today. Thank you for all the information that you provided to us. And let me turn the mic over to you.
Well, thank you, Governor. It's certainly an honor to have you here on our campus and to have you joined by leadership of your administration who've been at the forefront of the the state response to COVID-19 and now laying the foundations for our ability to address the combined challenge of flu and COVID-19. And thank you for the clear message that you're sending, that our future is really in our own hands to a degree, and rests with our collective willingness to use what we know works, wearing masks, maintaining physical distances, using appropriate hand sanitizers and other measures, because we have seen the downturn that you've noted has occurred across many areas of the state right here in North Texas. And that's especially salient to those of us at UT Southwestern and in other healthcare settings who see the human face of the tragedy of this pandemic when the numbers begin to rise. And we do understand we're facing a challenge of a flu season unlike any other because of the convergence with COVID-19. And I can only emphasize, I can't emphasize too strongly your message of the importance this year of getting that vaccine early so that we do everything we can to diminish the overall impact of flu and the potential stress it will place on our ability to provide all the care needed by the peoples of North Texas. We at UT Southwestern stand ready to help in any way we can, and for anybody who seeks help from our caregivers. At the same time, as you heard earlier this morning, we are working as hard as we can to identify more effective ways of treating and preventing both COVID-19 and flu. And only can hope that those efforts will eventuate in tools which allow us to go beyond our current dependence on non-pharmacologic interventions alone to really have the means of bringing this pandemic to the eventual close that we all look forward to. So thank you for your leadership and your support throughout these months of great challenge for our state and our community.
Sure. Thank you. I do want to emphasize that the Texas response really is a response collectively, especially by everybody who is in the legislature working either on the front lines in their communities or working behind the scenes in their committees, working to provide advice, whether it be to me or to the Speaker or to the Lieutenant Governor. And we have some of those leaders with us here today. I want to recognize from the Texas State Senate, Senator West, Senator Paxton, Senator Hancock. Thank you all for being here, as well as Representatives Button, Representative Niavi, and Representative Anchia. Thank all of you for being here, but more importantly, thank you for the leadership role that you provide in the Texas legislature. Let me go next to Chief Nim Kidd, the Chief of the Texas Division of Emergency Management.
Thank you, Governor. And as the Governor mentioned, we responsibility for PPE, for testing, and for staff. Our personal protective equipment needs are being met in the supply chain. Our private sector supply chain is continuing to come back up, so doctors, nurses, hospitals are buying from the private sector. We will continue to stockpile to ensure PPE is ready. We continue to support testing across the state. Today there are over 1,700 sites in Texas that Texans can go get a COVID-19 site. Less than 50 of those are supported by the state. The rest are in the private sector. And as far as staffing goes, Governor, we have over 8,000 people assigned to the COVID response right now. A little over 5,000 of those are healthcare workers, many of them under the direction and supervision of the Department of State Health Services. Hats off to UT Southwestern, Parkland, the doctors and nurses out there in the field every day taking care of Texans. Thank you.
Thank you. Next is Commissioner Dr. Hellerstedt of the Texas Department of State Health Services.
Thank you, Governor. I just want to echo the theme of prevention. We want to prevent COVID-19 from spreading in our communities. We want to prevent a really bad flu season from coming upon us. Now, the good news is that we have seen that the policies that have been put in place by the governor and backed by other legislative leaders have really blunted the amount of COVID-19 that's circulating in our communities. And one of the most sensitive indicators of that is the number of hospitalizations that are every day attributed to COVID-19. That has been coming down steadily in a very good trend. We must sustain that, and we must sustain that at the very least through the flu season. For a physician, the symptoms of flu and the symptoms of COVID-19 are very, very similar. So what we want to do is decrease and prevent both. Now, in the case of COVID-19, you're all very familiar. You're wearing masks. We've talked about the hygiene and the hand washing and the things that are so-called non-pharmaceutical interventions. But the even better news is that in the case of influenza, we have an excellent vaccine that has been proven to be very effective in the flu season in the southern hemisphere, and that's the flu vaccine that we'll be using here. And we also have other medications that are effective against flu. So when we want to prevent both influenza and COVID-19, we have the things out there that we're using that are effective. We know they work to blunt the spread of COVID-19 in our communities, and we need to add to that people getting their flu vaccine as early as possible, and then having the ability to test for both influenza and COVID-19 as the season approaches. So let's stay where we are in terms of the vigilance and the discipline that we have for the measures to prevent COVID-19, and in doing so, I hope we will have the very mildest flu season on history.
Thank you, Doctor. Next is Dr. John Zerwas. Dr. Zerwas is one of the 4 doctors who advises the Governor's Committee in response to COVID-19, but also he is the Vice Chancellor for Public Health for the University of Texas System. Doctor.
Well, thank you, Governor, and thank you for your leadership throughout this and for the very strong and bold initiatives that you have taken. And I think that the reason that we're seeing some improvement in the numbers today related to COVID-19 are directly related to the emphasis you put on masks and your emphasis that you put on trying to keep congregate settings to a minimum. And these are things that obviously can be very important during the flu season. As the Commissioner just noted, though, we have a vaccine for the flu, which is obviously a very valuable thing. And as I contemplate some of the things I got to do both from a medical and from a legislative point of view with many of my colleagues here, was actually the mandate that if you work in a hospital as a healthcare worker, you have to have a flu vaccine. And that's a requirement. Typically there's some kind of note on your badge that means that you had that done. And the reason it is certainly to protect you as an individual, but it was to protect the patients. Because if we had the vaccine, then we don't put our patients at risk who may be immunocompromised and ultimately would have a bad outcome from that. Something that we have talked about, though, in the past is that, for those people that don't have a flu vaccine, or for some reason they can't or don't have, they have some type of religious conviction that requires them to not have it, they wear a mask. They wear a mask, and that's the protection that they have in order for the patients to not be susceptible to that. And so the flu vaccine is something that has been incredibly helpful in us dealing with the influenza disease. I can't emphasize that enough, both as a physician, as somebody in public health, that there is anything better. And I would venture to say there's probably not been a greater public health accomplishment than vaccine development and then ultimately the uptake of those vaccines. And so I echo the comments that have been made here and look forward to us continuing to push that message out. So thank you for your leadership.
Thank you, Doctor. We will take a few questions. Or not.
If we do see a COVID vaccine this flu season, is there a plan in place that you guys are looking at to roll that out in as many places as possible?
So I want to make sure I understand what your question was. You said if we see a COVID vaccine during the flu season.
COVID vaccine is approved and comes out.
Well, I will let the doctors talk about it, but it may be aggressive to say that we will have a COVID vaccine during this flu season. But doctors, why don't you let them know more about your perspective?
Yes, we at the Department of State Health Services, as well as other health departments around the country, have been in conversations with the federal government, the CDC in particular, in terms of how would we distribute a COVID-19 vaccine when it becomes available. So there's still a lot of planning going on there. but I can assure you that just as we have a very robust ability to distribute influenza vaccine through our Vaccines for Children's program and our adult safety net, we will use the same type of programmatic approach to distribute COVID-19. So I think it will, when it's available, we have the means in place to do that distribution efficiently.
I will tell you this, and that there are multiple COVID vaccines that are being advanced at a very swift pace through Operation Warp Speed. That said, my anticipation is that before seeing a COVID vaccine, we will see additional COVID treatments that will provide some level of assistance, but not what you would see through the type of immunization that would occur because of a COVID vaccine.
Governor, you are on the lawsuit for MTX, the legislator saying that you need to call the legislature back in to have input on policy. At what point, at what signs would you need to see to do that, or is it just something that is not going to happen until the next legislative session? Like, when would the legislature be involved in this disaster response?
Sure, several things. First, with regard to that lawsuit, listen, I've been sued too many times for me to count. Every lawsuit that's been filed against me has either been I either won in court or has been dismissed, either by the courts or by the parties. And this lawsuit will meet that exact same fate. Second, people need to understand that legislatures have been involved in all of this decision-making process from the very beginning. So I confer both with the Lieutenant Governor and the Speaker 3, 4, sometimes 5 times a week. And we meet frequently for all the key decisions that are made. In addition to that, there are committees in the legislature when we're not in session, just like there are when we are in session, where decisions are being made with regard to some of the most important issues. I can give you several examples, and that is the CARES Act funding package that was passed by Congress that came to the state of Texas that provides a tremendous amount of funding for our communities. Decisions about the CARES Act funding were made by leaders with regard to Texas Senate Finance. The Texas Senate Finance Chair, the Texas Senate Finance Vice Chair were involved in that decision-making process along with the Lieutenant Governor, in addition to the House Appropriations Chair and Vice Chair working with the Speaker. Separate from that, with regard to education, for example, as you know, TEA as well as state put out several education recommendations, and those recommendations were made with the advice and input of not just the Speaker and Lieutenant Governor, but also the chair of the public education committees in both the House and Senate. And so those are just several of multiple examples of the way that the legislature continues to play a role as we work our way through this process. Yes?
Is there a way to make people get to the scene, people that is skeptical about it? Do you plan to have like an advertising campaign, media campaign? How are you going to make people do it?
And the vaccine you're talking about is the COVID vaccine?
Not the COVID,
The flu?
to prevent the flu season.
Sure. On the flu vaccine, we received some input earlier, and I'm looking for the person who provided the input, but some input earlier from the Public Health Authority here in Dallas. There you are.
Okay.
Do you want to tell them what you told us?
Sure. I think that's a really important question. I think.
Sorry, can you state your name?
Sure. Kavitha Bhavan, and I'm an associate professor of infectious diseases at UT Southwestern Medical Center. That is an important question, and I think that we need to really aggressively go into communities and engage communities from within. We know historically that even though influenza does create considerable morbidity and mortality, that not everybody gets vaccinated. The vaccination, the ability to vaccinate has been there, but the uptake can be improved. And so some of the work that I've been doing with Parkland is going into underserved communities and engaging, for example, high school students to become health ambassadors and kind of do the messaging from within as a source of trust and sort of building the health and well-being of that community. And we've seen some good results. So we're continuing to work in that space and develop research to kind of think through communities that are underserved, that typically are under-vaccinated. How can we improve upon that and get the messaging to kind of occur from within?
And did you say something about the vaccine being available for free?
Oh yeah, and the vaccine is available. So our health department offers the vaccine, and we do the best that we can traditionally to go into neighborhoods and offer flu drives. But historically, the turnout hasn't been as ideal as we'd like it to be, particularly if you look at sort of underserved Hispanic populations, for example. And I think some of the things that we can do is kind of really think about how do we get creative, how do we work with individuals that live in that community and make more culturally specific kind of campaign messaging to enhance uptake and improve health.
With all precautions being taken for COVID, mask wearing, social distancing, are you expecting a lighter than usual flu season because of this?
Great point. And this doctor made that point earlier, and it's been repeated by other doctors, and that is the anticipation is because people in the United States have begun to adopt best practices to reduce the spread of COVID-19, such as wearing a face mask, such as sanitizing hands, such as maintaining distance. That should lead to a flu season that is not as severe as it would otherwise be. And so if Texans can continue the disciplined practice of all the safe practices that will reduce and slow the spread of COVID-19, it will also reduce and slow the spread of the flu.
Last question. Governor, you talked about the continued spread of COVID-19 through family and friend gatherings. Are you concerned at all that with the start of school, that's going to increasingly become a problem, not necessarily at the school, but such as sleepovers or parties at the high school or college level and things like that? And what's your message to parents on that front?
You're making a very important point that I hope you and others will get out, because our greatest concern when school begins is not a spread of COVID-19 because of students going into schools, which we know will be a very structured situation with the schools providing the best safe practices. Instead, our concern is we will see an increase in spread of COVID-19 because of gatherings that take place outside of school that could lead to the spread of COVID-19. And so as students depart school for a day, they must maintain the very safest practices as they go home, and do not gather in these different types of locations that will lead to a spread of COVID-19.